Hi, I'm Dr. Chris von Rosenbach, partner in the dental health group located in Burlington, Ontario. I'm going to talk to you now about something that faces every parent at some point and may also face some of our hockey playing patients, and that is the case of the knocked out tooth. What do you do? So first of all, if it's a baby tooth, don't worry about it, don't do anything at all. We never put back baby teeth. That's just one of those things that happens, and your son or daughter may walk around with a gappy smile for a bit, nothing to worry about. However, if you knock out an adult tooth, then the situation is a little bit more serious. So if you can find the tooth, you want to be able to pick it up by the crown, which is the white part. Don't handle the root. If the tooth is dirty, you will want to wash it under running water. And then, if you are not totally freaked out by this, bad choice of words, but the tooth needs to be put back into place. And if you can do it, that is the very, very best thing to do. Put that tooth back in, and if it's your tooth, you just push it right back into place. If it's somebody else's tooth, you will just place it and try and just basically get it to look even with the rest of the teeth. So if it's not possible for you or a bystander to put the tooth back, you will want to get in touch with a dentist right away. You have roughly an hour's worth of time with which to work. If you have a glass of milk handy, by all means put the tooth in a glass of milk. Another choice is to basically, if you're one of these people who's lucky enough to have lots of saliva, put saliva in a container and immerse the tooth in saliva and carry it that way. Under no circumstances can you let the tooth dry out. Another option, which if you are an adult and in control, you can actually park that tooth in your cheek and use that as the carrying place. If it is a child who's lost a tooth and you're not convinced that the child might not swallow the tooth, and don't do that, obviously you want to put it into a good storage medium. Milk or saliva is the best. Water out of the tap is not the best. Water out of the tap will cause problems. Once you get to the dental office, the dentist will administer some freezing and then put the tooth back into place. It will have to be stabilized in position, which can be done with bonding. Sometimes a flexible retainer can be made. But after a period of 7 to 10 days, the reimplanted tooth is going to need some treatment. Most likely the tooth is going to require a root canal treatment. This will save the tooth and keep it as a functioning member in the bite. And it's remarkable how often teeth can be saved in this way and avoid further more invasive types of treatments. If you are a teen and that tooth root has not fully formed, then the tooth very likely will not require root canal treatment. It will just require observation. A good supply of blood to the root of the tooth will allow the body to heal itself. So frequently, if you can find that tooth and put it in yourself, or have the dentist put it back for you, you may not even need further work than that, but you do have to work quickly. After a period of an hour has elapsed, then the results are a little bit more unpredictable, and that tooth may or may not reattach in the way that we would hope. It goes without saying that once a tooth has been reimplanted in the mouth, you have to have soft foods to eat. This is no time for really, really big submarine sandwiches or tough, chewy things. Keep the food soft. Be a little bit sensible about what you do. But if you think quickly and act carefully, very likely what seems like a horrible disaster can be repaired, and knocked out, or as we say in the world of dentistry, an avulsed tooth can be put back in, and it can reattach and remain as a functioning member of your dental team.